A child is vulnerable for a lot of infections. Hence, there are vaccinations. Now, what are vaccinations? Vaccinations are nothing but a preventive strategy against all the infections a child might face in his lifetime. Now, there are a lot of vaccines available in the market, hence a lot of confusion also available for you. A lot of parents ask us as to what vaccine to be given, what not to be given, what vaccine is recommended, what is not recommended, so on and so forth. Well, I would like to mention about National Immunization Program, which lays down certain recommended vaccinations which are mandatory by the Government of India rules and regulations. What are they? When the child is born, at birth, we give something called as BCG on the left shoulder, followed by oral polio drops. Along with that, hepatitis B intramuscular injection. After this, at 6 weeks, 10 weeks and 14 weeks respectively, we give repeated doses of diphtheria, pertussis and tetanus along with Haemophilus influenza B. This is repeated at 10 weeks, 6 weeks and 14 weeks. Followed by this, at 9 months, we give something called as measles. And at 15 months, we give MMR, mumps, measles, rubella. Now, there might be a new guideline which you might see, which might also say that MMR should be administered at 9 months, which also can be accepted. At 18 months, we repeat DPT, which is called as a booster dose, which is given at 18 to 20 months of age. And at 5 years, we give another booster dose of diphtheria, pertussis and tetanus. By 10 years, we give a booster of tetanus and diphtheria. Now, besides this, there are a lot of vaccines available in the market. Maybe for typhoid, maybe for pneumonia, maybe for chickenpox, so on and so forth. Now, a lot of parents today are so confused, should we administer all these vaccines? Now, well, let me make you understand, a vaccine is always protective for your child. It's always given in terms of protection. So, there is no harm in giving any of these vaccines, but none of them are mandatory. None of them are strictly recommended by Government of India. Well, you administer them, you have your child protected. You do not, the risk lies with you. You can always have this discussion one-on-one with your pediatrician and take the call as to what vaccine you should go ahead with.